So hi, you're tuning in to the Garage Clip from Matwork. We want to talk to you a little bit about upper thoracic extension and when we're doing that pull up with upper thoracic extension and trying to build upon getting this part of the back to work versus always that low back firing and people complaining of that area hurting. So let's look at the exercise. First we have Nicole here. I think you've seen her a few times in previous videos. She's going to come up and you can just do your regular pull up for me. All right, so we're on a pretty low level and people will say, oh, I can go higher, especially if they've been doing a group workout, you've been working more strength training with them. The intention with this exercise is rather than doing a pull-up where your chest is staying very parallel, we're doing a pull-up where we're adding that upper thoracic lift. So when she pulls up, you're lifting the upper chest up and then back down. So you're allowing what people would say is a compensation or the wrong way to the movement. This is our intention that we set was upper thoracic extension. So this is what we're looking for. The tendency is to really just drop into that low back, not what we want. So we want to think maybe telling the person to keep their abs engaged, but almost feel like your lower ribs are pushing into the glide board. Does that help? Yeah. The tension in your hands, you can have a grip with the hands, but feel as if you're lifting the back up and that lifting the back up and then you're trying to drawing the arms back. So you're maybe changing the sequence of the exercise. That's another way to tweak this exercise to get people successful. How does that feel? Good. We've talked about this in our trainings, but I'm going to reiterate this. We know this is the pull-up position for the lat bars. If someone has a lot of trouble bringing their arms over their heads, and I have this with patients and I have it with clients, that this position is super hard. It is fine if I told Nicole, you know what, let's just get you successful. We're actually pushing down and up, which even is better to have maybe the lat bars in that folding position. So she can still do the exercise with the group without experiencing any shoulder pain. If anything, it might help her come up into extension. Note that with this exercise, we particularly emphasize the upper back because we wanted to save that swan dive motion for later on. You can add that in later once the sequence of the upper back is there. So we'll just keep the lat bars here. You're going to lift from the upper back and then you can go into the low back and come all the way up. And you can add the swan dive in. Perfect. Add the lat bar. So the other thing I'm going to mention is as you incorporate more spinal extension, we get the, my back is really hurting. Or you look at them from across the room and you can almost see that that back is the first thing to fire. And there's a lot of compression happening at that low back. If you go into external rotation, some people kind of like that. They feel better because if they can drop their knees over a bit of the glide board, that can kind of let the pelvis kind of come into a little bit of a posterior tilt, which might help prevent that anterior tilt, which would then shear the low back. All right, what's another way to do this? Well, I can have her bring her legs together and rather than turning out, turn in. So the internal rotation will help to almost gap that area of the low back, which may help with any pain that someone's experiencing. So just try various techniques to help someone when they're doing this. But let's say, and you can rest during your million pull-ups. Let's just say now that you've done this exercise and you're still really struggling, or you know that the lower traps particularly weaken people. If you didn't know that, it's usually really weaken people, and that's a really important muscle for shoulder stabilization. A great way to introduce this exercise, help the back kind of get tuned in, is go back to that foundation exercise where the arms are out straight, you're in prone, we'll turn the palms to face one another, back stays in the same position, and as you can see, Nicole here is just lifting the arms up and down. You can add that extension of the back later on, but here, you're just gonna lift the head a smidgen, is just the arms. And you can cue the shoulder blades dropping. You can add this exercise in. Another way to have someone just tune into their upper back, if they're having trouble with the pull-ups or you're seeing a lot of shoulder elevation and you're thinking, okay, I want to really focus here. What do we do next? You enter into a low kneeling position. So she sits back. When you enter to the low kneeling position, you kind of go into that tucked under. So again, that helps to send the back into that posterior, the pelvis into posterior tilt, kind of flex the spine some. And then we're going to focus on just upper back thoracic extension and cervical extension. So she's going to lift up and she's going to come all the way. What do we typically see here? We see someone coming up really high, just to there, and you say, okay, great job, good job, come all the way back down. Then you're going to say, okay, let's try to change this a little bit. feel almost like you tuck under, pull that belly in, and think about lifting the chest up and away. And when I teach this in a class, if possible, I try to get my hands here, again, ask the permission, and put your hands into the lower part of the ribs. Give a little bit of a tactile cue of pushing down as she comes up, and then you're saying, okay, I really want you to emphasize here. And Nicole, do you feel that?
Yeah.
We told her to say that, but typically, no, she really does feel it. And that's just a way to help people get firing here versus always getting to the low back. So upper thoracic extension, I truly believe that this area is a very weakened area in most people. It's usually a cause of a lot of cervical pain and low back pain. So if you can get this area strong for people, they'll be standing taller, they'll be feeling better, and they'll be coming back for more. So thanks for tuning back in.